Hyperaldosteronism, that is the increased level of the aldosterone hormone inside the body. Now, it can be due to various reasons, just like the hypercortisolism. Obviously, the adrenal gland, the adrenal cortex is the culprit here. So, there can be any disease related to the adrenal cortex. Like there can be the tumor or adenoma of the adrenal cortex, or there can be the iatrogenic causes as well, like you can say the primary hyperaldosteronism, that is due to the idiopathic conditions. Now these can be like the suppression, the overactivation of the renin-angiotensin system, like, and you know that angiotensin 2 is activating the release of this hormone, the aldosterone from the body. So whenever there is the overactivation of the renin, it can also lead to the overproduction of the angiotensin 2 and the release of aldosterone hormone inside the body. Now let's see that how all of these causes lead to the different impacts on the body. The main impact that can occur is the high blood pressure or increase in the blood pressure. So let's see all of these things one by one. First of all, the most common cause is the idiopathic hyperaldosteronism. Now here, the cause of aldosteronism is not known. As I told you, it can be because of the overactivation of the renin-angiotensin system. Now, the overactivation of the renin-angiotensin system can be due to any reason, because of blood pressure regulation problem, because of any heart condition, or because of any the liver or respiratory problem as well. Now, when there is the idiopathic hyperaldosteronism, it will lead to cause the same symptom as the secondary cause of the hyperaldosteronism. Now, in the second common cause is the adenoma. As I told you, there can be the adenoma of the adrenal cortex. Now, this can be the unilateral or there can be the bilateral adenoma that can lead to the hyperaldosteronism. Now, whatever the cause is, it is idiopathic hyperaldosteronism or it is the adenoma of the adrenal cortex, all of these things are going to increase the level of the aldosterone in the body. Now, the aldosterone in the body is high. What is the function of the aldosterone? The main function of the aldosterone is to reabsorb the sodium. Sodium water retention will be done by the aldosterone. Now, sodium is reabsorbed from tubular urine back to the bloodstream. These are the bloodstream, and because of the aldosterone effect, the sodium and water is being reabsorbed. Now, along with the sodium, some other minerals are also absorbed, like the potassium and like the bicarbonate to some extent can also be reabsorbed. Now, because of this salt retention, what happens that there is increase in the blood pressure, and also because along with the salt, the water is also retained, that will lead to the increased blood pressure and patient will suffer from the hypertension. So this is the main consequence of hyperaldosteronism inside the body. Then there is another type of the hyperaldosteronism that is known as secondary hyperaldosteronism. The idiopathic one is the primary hyperaldosteronism, and the secondary hyperaldosteronism means that there is some renal disease. There is some kidney disease that is leading to the high level of the aldosterone, and that is leading to the kidney reperfusion and hyperperfusion and other symptoms that hypovolemia can be because of this secondary hyperaldosteronism. Now, moving on to the morphology of the hyperaldosteronism. In case of any adenoma, like there is any adrenal cortex adenoma, that can be unilateral, that can be bilateral, you can appreciate the changes in the adrenal cortex that is leading to the oversecretion of the aldosterone in the body. Now, here in this diagram, you can appreciate this is the border between the tumor. Here, this part is the tumor, and these are the other normal cells, and this is the border between the hyperplastic cells and the tumor cells and the normal cells, and you can appreciate that there is significant change in the color. The tumor cells are more brighter, and because there is the obviously deposition of the certain things, like the lipid deposition is there, like the eosinophil cells are also noted in the area where the tumor is present. They are more in number. So all of these changes you can appreciate in the patient who is suffering from hyperaldosteronism.